Right, so I think we'll go ahead and get started, and then we'll go keep letting folks in. I'm Susanne Killian. I'm the Associate Director for Student Engagement with the Center for the Business of Health. And I have Erin Leach, who's our program manager behind the scenes tonight. So we're glad she's here as well. We have our panelists joining us for the discussion tonight. We have Mark Piegore, Charles Gage, and Aditi Paul, who is on her way. And we're so excited that they're here with us tonight. We thank you all for joining us this evening for the panel, which is part of the UNC Center for the Business of Health's Career Networks program. Career Networks is a constellation of resources meant to educate and create community around the continuously evolving healthcare ecosystem. You can explore the CBOH Career Networks platform via the URL that I'll paste in the chat box in just a moment. For tonight's panel, we ask that you turn your video on and mute your microphone while not asking questions. But when you do have questions, please raise your digital hand and the panelists will be more than happy to answer your questions throughout the discussions. I will also pause every couple of moderated questions for audience questions as well. Tonight's conversation will be about experiences and perspectives from careers in the payer space. Again, we are going to have our panelists introduce themselves first, and then we'll go ahead and get started. So I am going to go ahead and let our panelists begin to introduce themselves. We'll start with Mark, then go to Charles, and take it away.
Awesome. Thanks, Suzanne. So a quick thank you to Suzanne and Erin and everyone who organized this. And thank you all for taking some time this evening to come listen and talk to us. We've been looking forward to it for a couple of weeks now. So my name is Mark. I work at Blue Cross and Blue Shield of North Carolina. I'm a principal strategic advisor who focuses on strategy, planning, and performance for operations and member experience. And so really at a high level, what our group does is annual and long-term strategic planning for the organization, and that includes operations, data and analytics, as well as member experience in our digital strategy. And we hope to define what sort of important investments we want to make, bundle up that work into a business case, and then monitor and report performance on it throughout the year. So I'll pause and toss it over to Charles.
Awesome. Thanks, Mark. And thank you, Suzanne, Erin, and CBOH for having us. And thanks, everyone, for joining today. Great to meet everyone. My name is Charles Gage. I'm the Director of Strategy and New Ventures for the Diversified Business Group at Blue Cross, North Carolina. So we've got some good Blue Cross representation here. My team is responsible for investments, for partnerships, and for direct acquisitions in areas of healthcare outside of our core insurance function at Blue Cross. So for those who are familiar with Optum, with United, or Carelon for Elevance, you can think about it in a similar way. My background is in strategy consulting, most recently with Boston Consulting Group, and before that in transformation consulting with Huron Consulting Group, doing transformations for hospitals and health systems. I've got a joint JD and MBA from the University of Pennsylvania from Wharton and Penn Law, and I did my undergrad at Keenan Flagler, so really excited to be here with you all. Love UNC as well, and recently moved back to Durham about a year ago.
Wonderful. Thanks for the great introductions. And just to let everyone know, Aditi is on her way. Again, it's a busy time for everyone. But I think this is a great time to start with a pretty general question that I think a lot of folks have. We throw around the term payer all the time, and we hear the payer industry. But can you all just kind of give us a start of explaining what exactly is a payer per se?
Sure, I can kick us off. At a very simple level, a payer, either ER or OR, depending on who you are, is somebody or an organization who pays for healthcare. So you can think about it in a bunch of different types of organizations, maybe incentivized to do that. You have commercial insurance payers, you have governmental payers like Medicare and Medicaid, you have employers who may self-fund their employees' health plans. But the payer is the organization that helps develop the provider network and process your claims and take in your premiums and all of that to make sure that your care at your provider is paid for. But I'll pass over to Mark to give his thoughts too.
Yeah, I think Charles captured it really perfectly. I guess just to add on to it, Aditi. Just to add on to it, as Charles mentioned, obviously some of the more straightforward things of collecting premiums and making sure providers and everyone get paid, but the payer itself does play a pretty interesting role in building relationships with hospitals and different networks to make sure that both the insurer and the hospital or organization and physicians are all kind of aligned and working towards the same goal. And that's something that's changed over the past few years and has been a pretty key highlight. And then, at least for me, since I was a career pivoter, new to not the healthcare industry, but for sure being part of a payer, there's a lot of functions that sit within a payer, within the organization itself. And so there's a lot of effort in what Charles does, sort of looking outside of the core insurance group. And then there's also a lot of work within the insurance company itself to develop a digital strategy, figure out how we can best leverage our data and analytics and things to help put people in the right place to get the right care at the right time, really.
Terrific, thank you. And I'm going to welcome Aditi Paul. And so maybe Aditi, if you wouldn't mind doing a combo, introducing yourself and then telling us just a little bit of your perspective of what exactly a payer is.
Yeah, no, thank you, everyone. Can you hear me okay? Yeah, okay, awesome. Apologies for my tardiness. I thought my laptop remembered how to use Zoom and it didn't. So it took me a little while to get on, but I'm really excited to be here. Like Susanne said, my name is Aditi Paul. I am an MBA UNC grad. I graduated back in 2021. Right now I'm serving as our Medicare executive director in a couple of our local plans here in Illinois, Michigan, and Wisconsin. I've been in this role for about 2 months now, and I'm really accountable for leading the day-to-day operations and performance when it comes to customer service, our stars rating, provider network, and most importantly, member experience and satisfaction. I've been with UnitedHealthcare for about 3 years now. I also sat on our Medicare national strategy team, so really defining and dictating what our national growth and experience objectives are as we think about UHC's national Medicare portfolio. And then prior to that, worked at Accenture in provider consulting, very focused on more operations and supply chain related projects. So to answer the second part of your question, Suzanne, and I think Charles and Mark kind of really hit the nail on the head, so I don't think I have too much to add. But when I think about payer, I think about those entities that are processing claims, setting rates, working with providers on reimbursement strategies. And I think there's also 2 categories of payers people generally think about. One is more of your government-sponsored payer, so programs that are offered by the government, whether that's federal or state. So you can think Medicare, Medicaid, and CHIP, for example. And then you have your private payers as well. So those are your UnitedHealthcares, your Blue Crosses, your Aetnas, Humanas, that are private companies, but also work with the government and other regulatory bodies to provide healthcare services and insurance to consumers across the nation. So that might just be the other category I'll add there.
Great, thanks so much. All right, so we're going to start with a question that I think is really interesting, especially for the payer industry, because it's such a dynamic industry and the roles are so diverse and unique. So I'd like each of our panelists to let us know a little bit about what the steps that they took to land in their current role. Tell us a little bit about your role and just kind of the career industry. Again, I know some folks were pivoters. Some folks kind of work their way into this industry, but tell us about how did you land in your current role and in your career? And I'll start with Aditi. Since you just came in, we're going to hit you twice.
Yeah, no problem. So I was not a a career switcher. I had healthcare experience before going into grad school, and for me, knew I wanted to stay in healthcare. I did do a little bit of an industry switch, going from consulting to now the health insurance industry. But I do feel like my MBA education really did help propel me to where I am today. Some of the specific steps that I took, I think my most important one was networking. So really broadening, expanding my network outside of consulting, outside of the region that I was living in, to really understand what are the different facets and subsegments within healthcare that I could potentially have an interest in and eventually make an impact in as well. So networking through the connections from UNC and outside were really core and critical for me landing here at UnitedHealthcare. I would say two is a lot of the experiential activities as well. So taking part in everything that CBOH has to offer, from the case competition to the STAR projects, healthcare consulting projects, and really sort of broadening your skill set that way was super pivotal for me as well. So I'll pause there, but I know Mark and Charles probably have more to add as well.
You can go next. Thanks, Aditi. So talk a little bit more about my role. So as I mentioned, my team is responsible for thinking through investments, partnerships, or acquisitions outside of our core insurance functions. So as the strategy team for our Diversified Business Group, I like to think about our responsibilities sort of in a funnel. My strategy team is top of the funnel strategy. What are the things that we want to put in there? What are the interesting opportunity areas that we want to explore further? We build out business cases. We work with potential targets or potential partners to develop those business cases, and we might present them to an investment committee. And then, that process starts going. We're involved throughout and doing some of the diligence and things like that. But there are other groups within the Diversified Business Group at Blue Cross who might actually run that deal process with, we've got corporate development, we've got M&A integration folks and operations folks and things like that. But then my team comes back in at the end of the funnel once we have made an acquisition or once we've established a partnership, and we help think through the long-term strategy for that specific entity, that specific project, and where do we want to go next? Where do we want to go 1 year, 3 years, 5 years down the road? So that's sort of more about my role. In terms of how I got here. So as I mentioned, I have consulting experience. Actually, all my experience prior to my role at Blue Cross was in consulting, and I actually didn't even have any of that experience was directly with a payer. I had a lot of healthcare consulting experience, and I worked for providers. I worked for pharma and life sciences, diagnostics, digital health, pharmacies, etc. But the one thing that all of them had in common is that's one really important angle of those projects. And oftentimes sort of the key answer to the key question that we were asking hinged on some sort of payer dynamics. And I found that to be really, really interesting. Calling back to the descriptions of what does a payer do, they really set the incentives in the healthcare industry. And so I wanted to be close to those incentives. So that's what really drew me to this role. And in terms of preparing for, the interview process, as Aditi said, networking is incredibly helpful. But, coming in without that payer experience, I had to really think about what is, of all my projects, of all the functions that I helped with, how could I identify a couple really interesting and applicable skills and think about how do I translate those skills into what would be needed for that role. And so identifying those key stories to be able to tell where you're already doing at least some of the functions of a potential role, and really selling yourself in that way was really important, I think, in terms of the interview process. But happy to go into any more detail too.
Yeah, thank you both. I think you guys will hear me echo pretty similar sentiments that both Aditi and Charles had. I mentioned I was a career pivoter, and so I was interested in healthcare, spent a few years working in a hematology research lab at UNC after graduating, and then sort of got interested in some of the business aspects related to my role at that time. And through a few conversations, learned more about Flagler, and it was really starting to get into the center of the business of health and grow kind of the healthcare footprint at UNC. And so that's something that I was really interested in learning more about. I graduated in 2020, and as Aditi mentioned, networking for me was super important in how I got connected to Blue Cross of North Carolina in the first place. And I'll also echo Charles's sentiment that thinking through your experience, whether or not it's in the healthcare industry or elsewhere, what you do currently, finding those stories and those translatable skills are important. And so for me, for example, critical thinking was something that I used commonly and was able to leverage some of those experiences and stories to kind of demonstrate what core competencies I had, because at the end of the day, you can really learn about any industry and people are willing to hire you if you're interested in learning about them, but some of those core competencies can't always be taught. And so highlighting those is super important. So I joined the organization in the enterprise strategy role, and then through my time and involvement in different aspects, sort of grew my network within Blue Cross of North Carolina. That's ultimately what led me to my current role, which is a strategy and planning role within a division. And so it's helped me to kind of understand broadly what we're doing at the organization and then get down into kind of some of the more detailed levels related to operations and member experience. So I'll pause, but happy to go into more details.
Great, thank you so much. Again, very interesting, diverse roles, but also different ways to go ahead and enter this industry. So I'm going to just pause for a second and see if any of our audience members have any questions that they'd like to ask at this time. Again, you can raise your digital hand and that'll kind of slide you over into our screen. And don't see any questions yet, so maybe we have to just talk a little bit more. Is there one?
Yep.
Oh, maybe I can't see folks. Let's see here. And so just unmute and ask your question, please.
Come on, Susanne. It's Yellow Day.
Oh, yeah. Oh, there we go. Now I see you. Oh, my goodness.
Good. High five.
Yeah.
So definitely this topic for me is the most driving for me. Really, when I saw this payer source panel like this, because with my background, and I will just wait for this session to get started. But first, I definitely want to connect you guys on LinkedIn. How do you get your name marked without your last name like that? So I will connect on LinkedIn.
I have no idea. I'll just put my name in the chat though.
Okay. That's all I have for now. Thank you.
Thanks so much. Kira.
All right. Hi, good night, everybody. My name is Kira. I'm part of the class of 2026 with the MBA program. I'm also an MD student, so I'm doing the dual degree. My question is, what are some things that you wish providers knew about your roles within the payer side?
I can perhaps take that first. A lot of the work I do is with providers, either through our owned assets. Blue Cross North Carolina owns some provider assets, FastMed Urgent Care, and also Allo Solutions and Advanced Care, which is a primary care practice group, integrated primary care managed service organization with a primary care practice group as well. So do a lot of work with them. Hopefully the owned folks know a lot about our mission, but also a lot of my partnership conversations are with health systems in the state. And so my the biggest thing I try to get across at each point is because it often feels like payers and providers are on opposite side. They are on opposite sides of the negotiating table, and it often feels like an antagonistic relationship. And so the one thing that I like to try to drive home at all times is that we are all trying to work for the improvement of healthcare in the state of North Carolina in particular, but in the United States and the world. And so really anchoring in that, I think, is important, and always reminding about that. And that can come in a bunch of different forms, whether it's improved outcomes, it's improved affordability or lower costs for the overall system, improved experience of the patient and the provider as well. So all of those things are really important for me. And from a Blue Cross perspective, within the Diversified Business Group, where we are out there trying to make investments and partnerships, like that mission is really core to what we do. And making healthcare better for all North Carolinians is like should be stamped behind me. And so like I think that making that connection with providers and realizing that we're all on the same side to make the healthcare of our patients or our members better is really important to anchor that conversation in.
Yeah, I'll just echo Charles, 1000% agree. Sometimes payers and providers are on opposite sides. Sometimes they're pitted against each other, but we all have one common goal and objective, and that's to provide affordable, accessible, equitable healthcare to all of our members. And so that's one thing I would say is like we all are aligned, we all want the same thing. So we need to find ways to work together as an industry to make sure we're accomplishing that objective. And maybe a minor thing I'll add too is one really unique aspect about healthcare is it's also a regulated industry as well. So a lot of the policies that we get come down from a Medicare perspective, at least from CMS. And so sometimes our hands as a payer are tied as well, and we have to be in compliance with what CMS regulations and policies are too. If we weren't, I'm sure we would deliver healthcare in a very different way and setting, but sometimes that's something that we need to keep in mind as well, as it's a very regulated industry and we have to be in compliance with everything else that's on our plate too.
Yeah, I think that's an awesome add, Aditi, and definitely will first of all echo Charles's point that we talk about it all the time. I'll talk specifically for Blue Cross of North Carolina, but how can we make healthcare better for all as we're going through our day-to-day tasks, like try and think about how you're spending your time and effort and energy to ultimately try and improve health outcomes for people. And so something that like the organization itself spends a ton of time making sure all the people there know about it and it's felt. And I think that's super important. And I guess one of the minor things I will add, again, this is specifically from Blue Cross's point of view, but know that other payers are doing similar things. Customer experience is super important for us, and that includes finding better ways to listen to providers and members. And so from a planning perspective, one of our main drivers is working with our customer experience team to understand what are people calling in and complaining about, where are we not able to do effectively, and then how can we make sure that as we're planning those initiatives that we want to perform the next year, that we're really solving those key problems. And so there's a lot of effort that goes into helping to just really directly listen to providers in this case, but members as well, to understand what are they really asking us to do and how can we fix those problems.
Awesome. Thank you so much.
Great. Thanks for the great question. And it elicited great answers. We have another question, Jamie.
Hi, my name is Jamie. I'm a dual MHA MBA student. Mark and Charles, I don't know if you can speak to this, but there's been a lot of talk about Blue Cross losing its contract with UNC. And so I'm curious how Blue Cross is planning to evolve and react to this change.
I'd say I don't know if either Mark or I are the best folks to talk about contract negotiations and things like that, just given how confidentiality and stuff. But I believe that UNC contract has been signed. But again, don't want to talk out of turn on that one. But the only thing I'll say is obviously UNC and other academic medical centers and large health systems in North Carolina are huge drivers of high quality care for North Carolinians. And so, all of that is ensuring that our members have good access to that care is really important and a top priority for a few different teams at Blue Cross North Carolina, just not my team. And I don't think Mark's team either.
Yeah, sorry, I don't have a ton more to add to that, but to Charles' point, we do talk about and think often how it can be involved across the state and really help people in all 100 counties. And so it is something we think a lot about.
All right, thank you.
Michael.
Hi, thank you for being here. So my question is a little bit more general. I'm also a dual degree student with the MHA program an MBA program. So my question is kind of two parts. One, what drew each of you to the payer industry or the payer sector of healthcare in the first place? And specifically, what drew you either to Blue Cross Blue Shield or North Carolina Blue Cross Blue Shield or UHC? Kind of want to know what's your favorite part, or like what do you like about your company?
Yeah, I'm happy to start. And I think Charles may have touched on this at the beginning, but one thing that really drew me to the health insurance industry is just the scale and impact you can make from a health insurance company. If I think about UnitedHealthcare from a Medicare standpoint, we are the largest Medicare provider. We've got over 15 million members. And so just understanding that anything that I can do here is impacting 15 million and more members across the country was something that really resonated with me. Being a very mission-driven individual, I wanted to do work that was going to be hopefully making a difference. And so that really attracted me to the health insurance industry as in general. And then to UHC specifically, it was a couple of different things. One, again, the scale and impact and size of the company. Two, I think was just the community culture here. Everyone at UHC really breathes and lives by our mission of delivering better healthcare and making the health system work better for everyone. And so really loved being surrounded by people that share that same sentiment and mentality, and really wake up early in the morning and like are passionate about the work that they do. And so just to be around those types of people was really inspiring and motivating for me as well. And then thirdly, I will say also mobility too. I think you've heard through this conversation of there's a lot of different facets that you can do within health insurance. And Charles, Mark, and I, we have 3 very different jobs, but all very interesting jobs at the same time. So to have the opportunity where you can try a lot of different things as your skills develop, as your interests change, I think there's just a lot of opportunity to explore and try new things in a health insurance company too.
Yeah, thanks, Aditi. I'll definitely tag onto that. To the payer industry in general, it's not something that I came into my MBA targeting per se. Honestly, I didn't know a whole heck of a lot about it. And so it really was utilizing the resources that are available to kind of understand what is a payer, what do they really do. And so for me, I learned more about what that really is and how there are a lot of different opportunities that exist within the payer industry, and how ultimately payers are really in it to collaborate with the various other facets that sit within healthcare to actually try and drive down cost. It's not that they're just collecting money. And so that for me kind of made me realize that there's a lot of different areas that I could impact. And then for specifically Blue Cross of North Carolina, I actually grew up in North Carolina. And so for me, both location wise and wanting to contribute to the state of North Carolina, being able to work at Blue Cross of North Carolina was pretty important to be able to stay locally, and then also work on items that were really going to help improve healthcare within the state. And so that's kind of what drew me, I guess, to Blue Cross of North Carolina. And then transparently, I'm guessing Charles will probably agree, but the culture at Blue Cross is really fantastic. You know, if you can talk and meet with leadership, and they're always willing to come and sit down and talk with you, either from like a mentorship perspective or just to learn about more in the healthcare industry. And so kind of that dynamic and the culture at Blue Cross was a really big draw to me, and it's something that's kept me here for the past few years.
Yeah, and I'll just quickly echo pretty much everything that Aditi and Mark said. I referenced it a little bit earlier, but in all my consulting projects within healthcare and life sciences, there's, it's just so clear how much of an impact that you would be able to make at a healthcare payer, given all the different tentacles that the financial incentives end up having across the whole healthcare ecosystem. And so to me, that was just really, I wanted to be as close as possible to the ones who are setting and driving those incentives. So that's what drew me to the payer side. Blue Cross North Carolina in general, 100% agree, with the culture piece that Mark said. and also the chance to impact and be be close to the community and impact the community. Blue Cross is a single state blue, not-for-profit, mission-driven organization, and so that really resonated with me. And also the location piece was also a big one. I was I spent my entire career in consulting and traveling, and was really excited about finding settling down and finding a home in the Triangle. Given my connection to UNC, I actually met my wife at Keenan Flagler, and so she's from Chapel Hill originally, and so we wanted to settle here, and being able to do that so close to a lot of great things in the Triangle was a big factor for me personally as well.
Great. Thank you for those wonderful answers. And again, too, for the audience, and especially folks that are students, thinking about holistically when you're looking for your career. I love that folks mentioned culture. I love that folks mentioned location or growth, and looking for those next steps to be those places of growth and comfort and excitement for you, because that's only going to get you enthusiastic to move on in those companies and beyond. That's just might be your next step. You've got many more steps beyond that. So thank you all for those great contributions. We have another question, Ty.
Yeah, so I'm just want to add this comment to Jamie's point earlier when she was asking about Blue Cross Blue Shield lost a contract with UNC. So a little bit about my background I didn't introduce earlier. So I graduated with my master's degree in nursing 23 years ago, believe it or not. Right now, I work at WakeMed as a hospital administrator, but I have 15 years in case management and mainly utilization management. And you know what I'm talking about. So I do see I call a wave of change, speaking from the WakeMed standpoint. At one point, I think like 3 years or so, stand still with UnitedHealthcare, that we would not be able to reach to an agreement just similar to Blue Cross and UNC right now. But then realize too that there are large patients that is carrier for those type of payer source, and it will turn around. And I think the combination with negotiation and the larger patient population in the areas, and also with the Medicaid expansion plans as well. So North Carolina gone to that Medicaid managed plan back in 2021. So I will participate in that group space in terms of from the state standpoint, because I will work for the state at that time before I switch over to WakeMed. So I did want to add to that point that I do see changes in the healthcare industry as payer, they not with something, but eventually it's going to work out, because just like you all say, at the end of the day is the best for the patient.
Great. Thank you for that contribution. We appreciate it. And we have a question in the chat. And this is from Rebecca. When negotiating access and pricing, what are the key factors that payers prioritize? Specifically, what types of value are payers looking for when assessing a product?
I can give maybe a high level response. I don't know if any of us work on more of the network negotiations and pricing side of the business, but it is a very complicated process whenever there's a negotiation going on with a provider system. But one thing I may want to add on where I think the industry is going, and kind of touches on what Di said around this being a very interesting time for healthcare, is we are doing a rapid evolution and move towards value-based care and value-based arrangements. Prior, when we think about healthcare as all volume-based, you kind of got paid for every service that you performed. But now we're really incentivizing providers on the holistic profile of a patient, and really promoting and incentivizing better, healthier outcomes. So as we think about negotiating with providers, we really want to assist and support providers through this sort of evolution to more value-based care arrangements, and making sure that they feel successful in working with their members to have healthy, better outcomes. So I don't know, that doesn't typically answer the question that's been asked, but as someone who doesn't work on the network side, I know more holistically, this is sort of where the industry is trending towards as we think about how we're partnering with our providers moving forward.
Yeah, sorry, I don't work directly with it either, but it's a great question. And I think Aditi hit the nail on the head with sort of the broader answer. I guess to add on to hers, and what falls a little bit within our wheelhouse from a data and analytics perspective is we do try and think about how we can use data and leverage what we have available to assist providers. And so I think that's something that, as Aditi mentioned, trending towards value-based care. How can we as the payer help share information in the right way with providers so that ultimately we're able to combine the data in the most effective way possible, draw the right insights, and with things trending towards generative AI and all those fun, exciting upcoming things, how can those start to be leveraged in new ways to help improve patient outcomes and lower costs overall? So definitely not directly the answer to the question, but that's sort of a perspective on it.
And I'll just echo what Aditi and Mark said. I don't have anything groundbreaking to contribute on that one. So, but great question.
Terrific. Thanks for the great answers as well. And more questions. I'm loving this tonight. Brandon, please ask your question.
Sure. Hi, Suzanne. Hi, everyone. I'm a big fan of CBOH and met Suzanne last April during a visit to UNC. So it's fun to be able to participate in a session like this. I'd love to hear, especially from Aditi and Charles, you both started early career work in the consulting industry and worked for very well-known healthcare consulting organizations. I assume you would recommend that to the students here as a way to get started, really to develop more depth of understanding of the healthcare industry, and maybe as a path to eventually work in payers. Obviously, some of us go directly, right out of school into a payer and learn it that way. So it'd be interesting to hear more about your thoughts on, your recommendation for consulting as an early stage career path. And then maybe Mark and others can add just very specific advice for the students as they prepare for their careers, if they are planning to work in payers, because it's a very different environment, obviously, than care delivery. Thank you.
Absolutely. Happy to go first. Yeah, I spent, most of my career so far in the consulting industry, first for Huron Consulting Group, doing large scale transformations for hospitals and health systems, mostly within Office of the CFO and revenue cycles more specifically. So very, targeted and operationally focused, really got to understand what the care delivery ecosystem and the financials behind that look like. And then I pivoted after my graduate school into a more generalist strategy consulting role, though spent, the majority of my time there in the healthcare and life sciences. And that honestly, both experiences, but in particular, the strategy consulting truly felt like an extension of my education, but just hands-on learning. It was just project learning all the time. And so, I felt like I was getting paid to learn a new topic and a new skill set every day. And I could not recommend that more. I really enjoyed the experience, and it was just a phenomenal learning experience. I will say that depending on your personality and what you value in terms of work-life balance and things like that, there may be a finite time that you want to spend in that industry, but at least in terms of getting ramped up on topics and learning skill sets, both hard and soft skills, I really wholeheartedly endorse the consulting pathway. But that being said, I do think that if you know what you want to do right off the bat, I think that it's very difficult to replace, time in industry. And if you go the consulting route, particularly a generalist consulting route, you're going to be spending most of your time in at least topic areas that aren't going to be, potentially directly relevant to what you want to do down the road. As I mentioned, I didn't even spend any, I had no projects where a payer was my client. And so if I had spent more time, in the payer industry, perhaps I'd have a little bit of a different perspective on that too. So all that to say, yes, I think it was great for me. I think it can be a really, really great path, but not for everybody, particularly if you have a laser focus on where you want to go.
Yeah, and I'll agree with Charles. That was sort of my intent of going into consulting, is didn't really know what I wanted to do in healthcare, and consulting would give me sort of that breadth of experience and really understand what are the different facets of healthcare and where maybe are my interests really lying. So I think it is a path, but again, not the only path. Now that I'm on more of like the industry side too, I've noticed that a lot of companies have internal strategy departments that do a lot of the very similar type of work. They have internal consulting arms too. So I think nowadays there's a lot of different avenues where you still could get a lot of breadth and now depth as well. But like Charles said, it really kind of just depends on what you're looking for and what you really want to do long term as well.
Yeah, I think I was about to touch on something that Aditi just did, having jumped straight into the payer industry. It's not something that I necessarily thought I would come into and stay for a long time per se, but it was recommended to me that it's a great place to start because you do interact with a lot of different entities within healthcare and can learn how the money sort of flows, which is always important. But to Aditi's point, even within Blue Cross of North Carolina, for example, there are a ton of functions that sit within it. And so for me, I started in enterprise strategy, and what I do now has allowed me to learn a whole other focus within the payer industry specifically. So I think that that's important. And then I guess more generally, storytelling and some of the soft skills that Charles mentioned. My role is predominantly stakeholder management to some extent. And so being able to build those relationships and kind of communicate what you need to do and why it's important for different entities and sort of how it fits into the overall picture is something that's been important to me in my roles.
Great, thanks, panelists and audience members. You're making my job easy tonight. So many great questions. So thanks, Brandon. Bradley?
Hey, thank you, Suzanne. Another student here. My name is Bradley. I'm a first year MBA candidate at Keenan Flagler. And I think it's especially unique today that we have the not-for-profit lens, but also the for-profit lens. And so my question is rooted on that perspective, but in terms of trends and challenges. And so how would you say the not-for-profit and the for-profit payer organizations are approaching trends and challenges, and how are they overcoming them?
And kick us off. I've only worked for a not-for-profit payer, so it's a little difficult to try to put myself in someone else's shoes, but I'll let Aditi speak to the for-profit side of things. But one thing that our CEO at Blue Cross NC always says is no margin, no mission. And so I think that you'll probably find a lot of the perspective of for-profit and not-for-profit payers actually fairly similar. You have to be able to fund the mission, and at the end of the day, for-profit payers and providers also have very similar missions to not-for-profits to make healthcare better for Americans and for those worldwide. And a lot of the dimensions that we're thinking about in terms of improved outcomes, improved experience for the patient and the provider, affordability and lower costs of care and things like that are all the same, regardless of whether it's for or not for profit. So I honestly think it's actually probably more similar than it is different. Though I'm sure there, in specific instances, just depending on, if you're a publicly traded company or a private company, like those factors may actually end up driving, different incentives versus the for-profit or not-for-profit distinction. But I'll let Aditi weigh in as well.
Yeah, no, I agree. I mean, if we think about the overall trends and challenges that we're facing it's the same, whether it's a non-for-profit or for-profit. They're all industry headwinds that we're facing and we need to address. So I don't think that is vastly different in any regard. The one component is, some of these companies are public, UnitedHealthcare being one of them. And we also do have a responsibility to our shareholders as well. So we do have to think about that component that maybe some of the other companies don't. But at the end of the day, like, our mission doesn't change, and we need to make healthcare better for everyone across the country. And if we need to sometimes sacrifice margin or financials, we'll do that. But I think overall, if we look at both sort of categories of companies, it's not going to change drastically based on how they're sort of set up.
Great. And thank you. I was going to say, did you get your answer, Bradley? Awesome. Wonderful question. Again, too, I heard you all do a great job, our panelists, talking about the skills that you use all the time in your work and the skills that you need to kind of be attractive in this industry. But are there some skills or experiences that you all really wish that you would have taken advantage of or gotten when you were in school, either in your graduate program or your undergraduate, that maybe some of our audience members can start to think about now, maybe some that you even shied away from or didn't think would apply?
Yeah, I can take a first pass at it. I guess maybe from more of a selfish standpoint, I think Team Flagler in particular does an amazing job of offering international opportunities, especially if you're involved in one of the full-time programs. There's not always a great opportunity in your life to take a set amount of weeks and travel with a group to an international setting and really get involved in healthcare. That kind of offers a really different perspective. I think, generally we talk about trends that are happening globally, but I did not participate in one of those. And I think actually having that hands-on experience and kind of getting that real life perspective would have been interesting and something that I wish I would have participated and kind of understand, because I have been able to connect with classmates both at my time and then since then, who have gone on some of those and not only have had great experiences, but have really shared some different perspectives on ways that I hadn't thought about problems. And so I guess I would encourage folks to look into that if it's an option.
Yeah, I would agree with Mark. I also didn't have the opportunity to participate in study abroad or international programs. So definitely encourage that. I think also one thing that has been super important in my role, especially, is the importance of data and analytics. And I know Mark kind of touched on this too, but yes, a big part of our roles is storytelling, but to make that all that more impactful is making sure you have the data and the numbers to back that up and really paint a well thought out logical story. So I'm in Excel and in data maybe 50% of my day. So being able to look at all these numbers, do the analysis, understand the trends, pull out insights, and be able to tell that in a captivating story is super important. So I would highly encourage to take as many data analysis classes and really make sure that's a skill set that you continue to build and evolve over time. And then finally, I'll also just say, if for those that are interested in healthcare, to take classes that look at other industries as well. You'll learn a lot about healthcare and from other industries that you can then bring back into healthcare as well. A lot of what we have has been done in the auto industry or consumer goods industry maybe 5-10 years ago is now making its way into healthcare now. So I think there's a lot of other industries that we in healthcare can learn from and apply best practices as we think about the future of healthcare as well.
I think those are both phenomenal answers. Would echo them 100%. My ads would be, as a student, people love to talk with you, love to hear what you are learning about and talk about what they do. And so just reaching out to folks and networking, but without, not necessarily having a set objective in mind from the networking to like get this job or something, but just to learn, I think is something that I wish I did more of. Because one, it's tough to find the time to do that when you're working, but two, it's also just not as natural of a conversation to have there. So I think that's a really important one. More tactically, I think deeper financial modeling would actually be really helpful for me in my role. I'm not building out intense financial models. We have a corporate development team who does that, but even just understanding the way businesses run and what everybody's incentives are and how valuations come into play and things like all of that. And if I had a stronger base in accounting and finance from a modeling perspective, I think would be really helpful for me in my role specifically, but also just in general. I think it's a useful skill to understand the way different industries work and how incentives are structured. So I think that's one that I would spike out as something interesting. If folks have not had an opportunity to take a class in modeling or something like that, I would encourage that.
Terrific, thanks. And some of these may be opportunities that students haven't thought of at this time. So thanks for sharing those. We do have another question in the chat. And this is from Steve, and Steve asks, as vertical integration has been an impactful trend within healthcare and the payer landscape, in what ways does vertical integration come into play in each of your roles and daily decision-making?
I can kick us off. It's with my role with the Diversified Business Group at Blue Cross North Carolina. Vertical integration is a huge factor. We have investments in sort of two key areas right now. One being third-party administrators or TPAs. That's very close to sort of traditional payers, but doing things like claims processing for self-funded employers and things like that. Our other space is care delivery. As I mentioned earlier, we own 2 care delivery assets and are always interested in exploring further. And so that is sort of the heart of the payvider vertical integration, where you bring the payer and the provider together. So I think about it every day, all day. For me, it is a really, really interesting opportunity to sort of bring 2 organizations in the value chain together and try to make 1 + 1 not equal 2, but equal 3. And thinking, how do we improve the member experience by creating a truly seamless experience between the payer provider, for example, and how do we deliver that type of value to our members and our patients? There are also a lot of challenges with it as well. Oftentimes, as we discussed a little bit earlier, the incentives of a payer and provider are different. And so having to navigate that and figure out exactly where in that table am I sitting at any given time can be challenging as well. But I think on the whole, there's a lot of really great opportunity. And as Steve, as you mentioned in the chat, there's a lot of trends that are, or a lot of companies are trending that way. From national players, you have disruptors like Amazon and others who are going in that direction. And so it's a really interesting space to think about. And so I'm very excited that I get to do that all day, every day.
Yeah, and it's also something that we talk about at UnitedHealthcare every day. We have our sister company, Optum, which is our care delivery arm. And Optum has a lot of different components that help sort of move the healthcare industry. We've got Optum Health and Optum Care, which is the largest employer of provider clinics across the country. We have Optum Rx, which is our PBM. We have Optum Insight. So there's a lot of entities and capabilities that we have across United Health Group that really help push the needle when it comes to vertical integration. And there's been a lot of studies out there that show the benefits of vertical integration from an affordability perspective, outcomes, satisfaction. So it's really finding that fine balance of tapping into the capabilities of both entities, different vertically integrated companies, and really sort of driving healthcare here. But it's something that it is a trend. It's not going to go away anytime soon. And I think we're all really excited about the prospect of what vertically integrated companies can do in the future too.
Yeah, it's definitely an exciting topic. And I guess I had a slightly different point of view as things get brought in to the company. It's pretty important from like an operations standpoint to understand ahead of time when those things are coming, so that we're making sure we have the internal sources aligned appropriately, so that as those things come in, we're able to effectively integrate really and realize those synergies and all those things that have already been mentioned. So there is definitely a tactical piece to actually executing the integration piece of it.
Great, thanks for that, those answers. And we are getting a little towards the end of our panel here. So I'll call out if we have any more questions. I'm just gonna look at the crowd, raise your hand. And if oh, we do, Michael, go ahead and ask your question.
Thanks, and thanks for sitting through another question of mine. So I feel like some of us, maybe a fraction of us, feel like eternal students doing multiple degrees and things like that, and not really having tons of work experience before our degrees. So I was wondering if y'all had any advice for us at like how do we position ourselves and kind of demonstrate or showcase our skills or the value that we can bring to the companies as we network and recruit and things like that.
I can definitely take a first pass because I didn't have, I guess, per se, like a traditional work experience. Like I wasn't in sort of an industry or corporate environment. And so something that was important for me was, one, the networking piece, as Charles mentioned, especially as a student, take advantage of it. People are really willing to talk to you. It's interesting to connect with students to understand what they're learning. And then on the flip side of it, I'm always willing to kind of see internally if there are interesting opportunities that align, and sometimes just have that introduction and understanding a little bit more can help you get directly connected to the right people, and really it's taking advantage of the opportunities that do present themselves. So for example, like I'll toss out a plug for the case competition because I know that's right around the corner. When things like that arise, make sure you get involved so that you're able to leverage those opportunities and kind of demonstrate and have good example and star stories that you can tell with kind of some concrete ideas. So I think CBOH does a great job of providing opportunities. So just getting involved and trying to do as many as you can.
Yeah, I would agree with that. If you don't have more of that traditional work experience, supplement that with what you are doing in school too. So even if you're doing team projects in class, really lean into those and create star stories from those that will help supplement sort of your soft and hard skills as well. Take advantage of all of the experiential activities that the school has to offer, the case competition, case conference, star projects, maybe some of I don't know if CSF is still a thing, but that class as well can have a lot of experiential opportunities too. So do as much as you can, and that will sort of supplement your overall sort of portfolio as well. And one thing I would add too is do a lot of research around the companies that you're interested in, or the industry as well. I think one thing that we always look for is just someone who's curious, willing to listen, willing to learn, especially in an industry that's rapidly changing every single day. So if you come curious, if you come well-informed and knowledgeable, that'll also be really good and a first good impression for anyone that you're networking and talking with too.
We're thinking, Charles, if you got 30 seconds to finish up the question, we'd love to hear it.
The only thing I'll add is just enjoy it. I did a dual graduate degree as well, and look back on some of that time, and as some that plus post my undergrad is some of the best years of my life. And so just hope everybody really enjoys the time, in addition to doing all the things that Mark and Aditi said, which are all very important, but also just have fun, and hopefully learning about healthcare or other industries, whatever you're interested in, is fun as well. So
wonderful. And thank you so much, first of all, to our panelists, to Mark, Aditi, and Charles for taking this time tonight. We always enjoy having our alums come back and just sharing, how they jumped into their careers and how their careers are dynamic and ever changing. So thank you for taking the time tonight, and thank you, audience. It's not early in the day, so we thank you for hanging in here and being a part of this great discussion. The questions were wonderful, so again, we appreciate you creating this wonderful discussion tonight. I also have a shameless plug. If you look in the chat, that we do have our next panel next Tuesday, digital health, technology, and health innovation. We'd love to see you there as well. But again, thanks everybody for your time tonight. It's great to see you as always, and enjoy.
Thanks, everyone.
Thank you.
Thank
Thanks,
you.
everybody. Have a great night.